I'm talking about individual and family therapy. An example organization I used was the University of Nevada. They have a center for individual and couple and family counseling there. Um, with the environment, they work in a clinic, agencies, hospitals, schools, and private practice. Hours are flexible to accommodate the families in crisis and working people who require evening and weekend hours. Therapists can set up their own appointments according to their wishes. However, often they need to meet the patient's needs in the evenings to accommodate those schedules, as I said before, with their work schedules. Generally, work time is full time and it's 40 hours per week. And the session is either an individualized session or a family group session. Typical stressors there might be is completing paperwork for insurance. That does take a good deal of time of the therapist's time. And comparison, you need to make sure that you are taking the time to have the compassion and patience and empathy with those patients. And that is something that can be stressful at times for a person. Typical benefits are your health benefits, dental benefits, vision benefits, life insurance, short and long-term disabilities, 401ks, stock plans. And if you're working with an organization, they usually are covering you for malpractice and liability insurance, which is good to have. A common job task would be mental health counselor, an individual and family therapist help people manage and overcome mental and emotional disorders and problems with their family or relationships. They listen to clients and ask questions to help the client understand their problems and develop strategies to improve their lives. Diagnosing and treating mental disorders, conducting psychotherapy with individuals, couples, and families, developing treatment plans, helping clients develop new interpersonal communication skills, and collecting information about the clients through self-reported inventories, interviews and observations, and also through discussions and formal assessments. In addition to promoting a client service, many professionals in the field spend time marketing their services also, particularly if they work in a private practice. Completing paperwork and dealing with insurance companies does take a good amount of time, and also working with the client, the therapist needs to make sure that they are maintaining the accuracy in the case of their notes and keeping up on that and keeping record of the evaluations and any notes for recommendations for further treatment. When it comes to education, you'll need the American Association for Marriage and Family Therapists to recommend or suggest that the minimum training to become a marriage and family therapist includes a master's degree plus 2 years of supervised clinical experience. After completing these educational requirements, therapists must also pass a state-required test, an exam. In addition to the basic training and educational requirements, it is important for the professional to have the characteristics that will allow them to help in the problem solving and communication skills. Therapists need to help their clients feel they're able to trust and share their innermost thoughts and feelings. They also need to be able to keep track of the case notes and other paperwork and manage billing and insurance claims, which is why organization is a very important quality to have in this field. Marriage and family therapists also collaborate with others, including family members and healthcare professionals. So strong communication skills are needed in this field too. Communication with different technologies can also be helpful. Individual and family therapists often utilize a range of technical tools, including video conferencing, account software, multi-line telephone systems, spreadsheet software, emails, medical software. You need to be aware of those type of things. The starting salary is usually around $41,000. An expert salary would be $75,000 a year. Some miscellaneous career information would be that it does seem that the employment of mental health counselors and marriage and therapy family counselors are projected to grow within the next few years. It's much faster than the average for all occupations, they're saying. Thank you.